Well, good evening. My name is Jim Wilson, and I want to welcome you to the next installation of our webinar series on the science, medicine, policy, and politics of the COVID-19 endemic. I'm currently a faculty member at the University of Pennsylvania Perelman School of Medicine, but I'm also a proud alum of Albion College. This webinar series is being sponsored by the Lisa and James Institute of Medicine at Albion College. Before we get started, I'd like to remind all of you again about the format for this evening's webinar. After our featured speakers make some introductory comments, I'll introduce the three students from Albion who will lead a discussion with our featured speakers about their role and their perspective on COVID. I'd also want to remind the audience to invite them to participate in this through the Q&A function. If you could deposit your questions during the hour, I will do everything I can to get your questions out to our speakers. So without further ado, let's move on with our featured speakers. And it's a pleasure to introduce two of our frontline workers from the nursing profession that really played major roles in managing the influx of COVID patients at their respective hospitals. I'll introduce both of them first, and then we'll have each of them make some comments before we bring the students back. So the first is Anjelica Dunlap. Anjelica is an intensive care unit nurse in a medical ICU at the Ascension St. John's Hospital. Anjelica got her Bachelor of Science at Michigan State University, and then her Bachelor of Science in Registered Nursing at the University of Detroit Mercy. She's been 3 years as an ICU nurse, and Detroit was particularly hit hard, and St. John's Hospital really was dealing with quite a challenge in managing these students, and according to leadership at St. John's, Anjelica played an important role in that response. In addition, I pleasure to introduce Kaitlyn Simmons. Kaitlyn's a clinical nurse 3 at the Hospital of the University of Pennsylvania on the vascular surgery COVID progressive care unit. Kaitlyn got her bachelor degree in chemistry, biochemistry at the University of Delaware, and then her bachelor degree in registered nursing from Drexel University. Her unit at HOP was the first to be converted to provide care for patients with COVID-19. And following that, Kaitlyn played an incredibly important role in mobilizing the hospital for what was to come. We have 10 of these series, and I particularly was looking forward to the one today, guys, because of what you did for your patients and for your hospital, and look forward to your comments and the Q&A. So we're going to start with just a few comments from Anjelica, and I'll pass it over to you.
Hi, good evening, everybody. I just want to say it's a pleasure to be here and to be able to participate in this program and seminar. I work at, like Dr. Wilson said, I work at Ascension St. John. I've been there for over 3 years. I actually just transitioned to going to school full time because I'm going to school for anesthesia. At the hospital, we were hit particularly hard at the beginning of March, and I would say that carried on throughout the summer. We kind of started to wind down at the end of June going into July, and I was in charge when we got one of the first COVID patients on our unit, and we had to get prepared. That first patient, I would say we weren't prepared, but as I continued on with the Ascension system and caring for these patients, we became prepared. And I was very grateful for everything that Ascension did for us as a health system. From a nurse perspective, the patients we were getting that were COVID positive and even COVID rule outs were much sicker than we're used to. And I work in an intensive care unit. We get patients who are the sickest of the sickest on all types of drips, and we're doing all types of interventions to save their lives. And what I noticed with the patients who had COVID is that the interventions we were doing that normally would help these people or patients that are very sick were not helping. We were overwhelmed. Our unit, which is normally 20 to 22 beds, we do have 2 beds that are for ECMO that nurses from the CVICU do come up and do ECMO on. Every bed on our unit, so all 22, were transitioned for COVID patients. We also opened up another unit, PICU, which is for pediatric patients, is right next door. We opened up that unit and expanded our ICU to 30 beds. And this happened within about a week. I was in charge also when we opened that unit and started taking our first ICU patients, because our unit was just overwhelmed with the acuity of the patients, the number of patients, the number of patients who needed ventilators, who needed critical care support. So we did open up that unit, and we ran for about, with 30 beds for, I would say, three good months. The patients just were much sicker than we were used to. They were coming in and having these respiratory issues and issues with breathing, and they would go, there was no in between stages. They would go straight to needing ventilators. I also noticed we got to the point we were running low on sedation, running low on ventilators, IV pumps, and Ascension really stepped up to the plate to help us and support the nurses. We also got a lot of help from different hospitals, and they had nurses come from other hospital systems who weren't hit as hard to help us take care of our patients. And it was just wonderful to see everyone come together as a team to help us, because it was a very, very stressful time. I also want to give some recognition to my unit, the medical ICU. We work as a team, no matter the circumstance, no matter what's going on. Everyone on that unit is a team player, and I'm so grateful to have grown and gained many skills there. One thing that really hit me hard during COVID was the amount of patients and the patients and families who wanted to reach out to those patients. And in the beginning, we didn't have a way. We did start using Zoom. The community donated iPads and different things so that we could connect the families with their patients. And it really made a big difference. Families were calling, the phones were ringing off the hook because they want to check on their loved ones. But of course, we weren't allowing any visitors. So the aspect of Zoom and different technology and devices like that really stepped in and stood in the gap for us and our patients. One of my most memorable things that happened to me during COVID was I had a patient who was not doing well. She wasn't going to make it out of the hospital. And I remember taking one of the patient telephones and hooking it up and actually calling and dialing her son. The patient was intubated. She was on bedside dialysis and wasn't really aware of anything that was going on, but I did call her son from the room. And I held the phone up to her ear so that he could talk to her and say goodbye and just give his wishes. And he could be there through the telephone with his mother because he couldn't be there in person. And it just really changed my whole perspective of what we do as nurses. We're standing in the gap for so many people and patients, and we connect patients and families every day. I'm grateful for what I do. I'll never take it for granted. Being a nurse is one of the most amazing careers. But COVID was definitely a struggle. I can attest to the acuity and the number of patients we have right now, because I did end up resigning from my position to go to school. But when I was there in August, we had, I think, maybe 2 positive patients and several in rule out and COVID rule out precautions. A lot of things have started to not wind down, but because we had this great massive wave, we've become accustomed of how to take care of the patients, how to triage them, what type of unit they need to go to, do they need ICU? And the patients that I saw when I was there in August were not as sick as the ones we were taking care of in March, April, and May, who were very sick. At one point, the entire 30-bed unit was all COVID positive patients. So that is just a tidbit of my experience. It was a very stressful time, but I'm thankful for the Ascension system, all of my coworkers, all of my family and friends who supported me. And I just think it was an experience that something I will never forget. And I'm hoping that as a country, we can conquer this and things can maybe not go back to how they were before, but we may just have to find a new sense of normal. And I'm going to turn it over now back to Kaitlyn so she can go ahead and give her perspective of COVID.
Okay. Hi, everyone. A lot of my comments are very similar to Anjelica's. Thank you again for having me here. I feel really honored that I'm able to be here representing nursing and the perspective of nursing and the experience of COVID. I have to give a big shout out to the team that I belong to. I work at the hospital, University of Pennsylvania, on a floor called Rhodes 1. And I have to give credit to the team that I belong to. It's an incredible team of nurses, and I know that we would not have made it. We're still in this challenge, but we wouldn't be where we were without the team that I have and the team that I belong to. And all of the doctors, I think one thing COVID really has done that's a new look, it's really brought together nursing with the physicians. It's really created a new team dynamic in how we take care of patients. This is a unique effort that's really taken everyone's best collaborative efforts to bring out good outcomes. My experience is very similar to Anjelica's. We got the first patient in March. Our floor was the first unit to be converted to a COVID unit. We were actually crazily excited in the beginning. We must have some crazy gene in our heads. We were ready for this challenge and ready to take it on. And we were actually a little excited to see, what was going to come. Equally nervous as well. And the hospital did a great job preparing us in terms of the right PPE. I have to say our safety procedures were excellent. Everyone was so safe with handling patients and how to sanitize and sterilize before we knew what we knew about how the virus is transmitted. So our experience, we quickly went from one unit of 24 beds to 6 units in the hospital. 3 at the highest peak, it was 3 full units of med-surg level patients and 3 full units of ICU level care. So it was tight in the hospital, but we were really fortunate to always have enough resources. We had to be really stringent with how we used our PPE, but I'm happy to say that we never didn't have enough. Other things that happened in my experience with COVID, the patients were a lot sicker than what we're used to seeing. I'm also from a surgical floor, so our perspective in how we care for patients is a little bit different. This is definitely a medicine issue, so we had to get used to kind of a different goals of care with dealing with a more chronically ill patient. Some other things that I want to touch base on, very much like Anjelica, we had to find new creative ways to be in communication with the family members. We still are not allowing any patient visitors for anyone who's COVID positive unless it's a really special circumstance. So we always have families calling. We've been utilizing a program called Blue Jeans on iPads to help patients talk to their families. FaceTime, we've been trying to get creative with ways to help patients. I remember at one point I was integrated into the ICU and I helped a gentleman. It was so sad and happy at the same time. He had made it out of the ICU. He had a trach, he had undergone a tracheostomy in order to have a stable airway, and we helped him FaceTime so that he could see his baby for the first time. His wife had given birth while he was intubated. So that was a really incredible day. I was crying, the other nurse was crying with this patient as he was seeing his son for the first time. But some really good outcomes came out of dealing with all these patients. In terms of nursing, it was really overwhelming at times. Again, the patients were really ill, and the way we were taking care of them had to change from what we're used to. You can't just run in and out of the rooms like you usually would with a patient because of the donning and doffing of the PPE. So we had to get creative with how we would deliver our nursing care. Also, in order the hospital to help reduce exposures, we had to come up with more responsibilities on nursing staff. So at one point, and it still is this way, nursing is carrying out all of the responsibilities. So we are food service, we're delivering the food trays, we're helping clean in the beginning before they had properly trained EVS workers, we were the only ones able to clean the room. We weren't utilizing nursing assistants or CNAs, so vital signs, all the care was falling to the nurse. And I think that it was definitely overwhelming at times, especially with how sick the patients were. Because I work on a med-surg unit, we were seeing patients as they were coming out of the ICU. So, really, still ill, incredibly deconditioned from everything going on. Excuse me, my daughter is crying in the background. Really deconditioned, needing incredible amounts of care. And it definitely was frustrating at times because we felt like we couldn't, where it would be no big deal to bring in all these extra resources, physical therapy. We weren't able to get them the things we felt like they needed. Also, getting certain tests was a really big challenge. If a patient needed a scan or an x-ray, it was really hard. We couldn't just wheel them down to CT scan. So there was a lot of strain and a lot of new creative thinking with, how are we going to provide the best care possible, but still keep everybody safe and minimize exposure. I have to say the hospital has been really successful with keeping nursing staff safe. We've had minimal staff contract COVID. Most people will attest they've gotten it from the community and not from taking care of patients. And everyone has been incredibly safe through this whole process. So I'm really thankful for that. Similar to Anjelica, things have definitely slowed down in Philadelphia. We are down to half of a nursing unit, which is our unit. So we're half vascular surgery now, doing what we normally do, and the other half of the unit is managing COVID patients still. They are a lot different from the patients that we saw back in March and April, which I think is just so unique with COVID. I've never seen a disease process that affects so many people so differently. So I think that's definitely really been interesting. And, our census stays pretty consistent. So we just have the half a unit of med-surg level patients, and then any patient requiring ICU is going just to their individual ICUs. So that's where we're at, my experience, but it's been a really big challenge. It's definitely helped bring us together as a team, and it's brought together, I would say, all of the staff of the hospital. It's really created a sense of camaraderie. But those are my comments. I'm going to turn it over to Dr. Wilson now. Thank you.
Great, thank you. Thank you, Kaitlyn, and thank you for Anjelica. Anjelica, if you could join us again, that would be great. All right, well, great way to get started. I'm getting some questions, a couple questions from the audience, and I'll find a time to share those with you. But right now, it's a pleasure to introduce students from Albion who will really drive the discussion with you guys today. So we're going to start with Allison. If she could join us.
Hi, my name is Allison. My hometown's actually Port Huron, Michigan. My major is kinesiology, and I'm a sophomore this year, so I'll be graduating in 2023. On campus, I'm involved in the EMS club, the Student Volunteer Bureau, and as well as the Wilson Institute.
Great, all right. Dylan?
Hi, I'm Dylan. I am a senior. I am from Clarkson, Michigan. I am also a kinesiology major. I am in the Wilson Institute as well as a SEC representative for the baseball team.
Great. And Natalie?
Hi, I'm Natalie. I'm from Holly, Michigan. I'm a senior and I'm involved with Albion Swim and Dive and the Wilson Institute. I'm a biology and psychology major.
Okay. All right, Allison, if you could join us again, if you're still there. Fantastic. All right, well, I'm going to pass it over to you guys as students. Maybe we'll get started out with Natalie, and I'll step back, and time is all yours with our professional nurses here. Natalie?
Okay, so my first question is, how did patient care change from the beginning of the pandemic to currently? And what is the biggest thing that's being done differently now?
I can start with that. I think a couple things we had to change with our patient care, like I mentioned earlier, we had to be really smart about how we provided care in a way that keeps the patient safe and keeps ourselves safe as well. So we've had to change our model to cluster our care more. We try to kind of go in and do everything all at once. So bringing in food, giving meds, and this has required really good communication with the providers. We've changed how some standard orders are placed, and we question, do they need vital signs as frequently as if they're more stable, so that we're not going in as much. Another thing we've started to utilize now that our volume has decreased a little bit, we've really tried to incorporate a team-based approach with nursing. So normally in the hospital, you come in and you have, your assigned patient assignment and you're in charge of those patients. Now we're shifting, when you're working on the COVID floor, we're trying to encourage this team model where, everyone is, maybe you're the nurse that manages the care, but everyone is assisting with patient care. So we utilize, we call them flex RNs, and they don't necessarily have an assignment, but they're helping the nurses don and doff with the PPE. They're monitoring them coming in and out of the room, but they're also helping with care and providing and helping patients get the care that they need. So I think that's probably been the biggest change in how we operate now.
Anjelica, do you have anything to add to that?
I just want to piggyback really on what Kaitlyn said. We clustered care and we kind of learned about working smarter, not harder. So there would be different things. We have patients all of our patients were vented. If they were a stable vent, we didn't really have to go in the room. We did things like taking the IV poles and adding extra tubing and putting them outside of the doors so that we could change different drip rates for them, but not having to go inside. If we needed to go in the room, we did it when necessary, and also clustered care, bathing patients, doing whatever we need to do, meds, doing it all while we are in there doing other things. So we're not just running in and out because of the amount of PPE that we had to conserve. And still we needed to be mindful of taking care of our patients. So really that's how things changed then. On my unit, we kind of gotten back to kind of what we were doing before COVID, but it has made everyone a little bit more mindful of ways to conserve, ways to cluster care, to be able to take care of our patients appropriately.
Okay. Dylan, do you have a question?
Yeah, my question was, from going and seeing your patients every day and like seeing their facial expressions and vice versa, like them seeing you, how is like the physical barrier of wearing a mask every day changed that experience with your patients?
So I want to say wearing a mask every day, I remember the first time I put on a mask and had my entire body really covered up with a gown, with a shield, and going into my patient's room, and she looked at me as if I was from outer space. She really did not know what was going on. And this patient had a language barrier. So it was difficult. She was scared. And I feel like I was doing everything that I could to try and console her and tell her it's okay. And we're here, we're trying to help you. It was very difficult because, facial expressions, body language, all of those things are a part of communicating with patients and talking to them and comforting them because they're going through something very scary. So it was a very hard barrier to get over. But one thing that really is not an upside of this is the patients came in and got sicker and sicker. And I would say most of the patients that I took care of really were not that aware of what was going on because they were all on ventilators. They were all sedated. They weren't really able to communicate. And, we just try and do other things to comfort them and put familiar things like they're trying to contact their family. It was a difficult part of COVID because it's nothing like what we were used to.
Kaitlyn, do you have anything to add?
Yes, I would say very similar to Anjelica. I think we scared the patients more than anything in the beginning when they would see us. We were wearing, for a while, we were utilizing, to help conserve N95 masks, we were utilizing PAPRs or personal air purified respirators, and it's like a space helmet. So I think whenever the patient would see us coming in with this big helmet, it's got a power pack on it with the gown, the gloves, everything else, even though they could see our face through the helmet, but I think the whole thing was a little overwhelming for the patients. I think some of them we made them more nervous with our PPE. I think, Dylan, I don't know if it's a sad thing or if it's a good thing, but now in taking care of patients, everyone has very quickly, I think, become very used to just seeing people in masks all the time. I think it's become common practice. And honestly, I have not had an experience where a patient has expressed, frustration or being upset because they can't see our faces. And the hospitals implement a policy where we're wearing masks universally. All staff are all day for our whole shift. So with any patient, not just COVID, we're wearing a mask in the room with them. And it's kind of shocking that it's become pretty common practice now. I don't think the patients that I just took care of last week, I don't think anyone thinks twice about seeing us with masks anymore. So hopefully that will carry out into the community and everyone will wear a mask all the time. And that's I think it's just how it's going to be for a while.
Allison, I think you have a couple questions. I'll pass it over to you for a bit.
Hi, yeah. One of my questions was, when you're working, how has COVID-19 make you stronger to be able to distance like an emotional connection while a worldwide pandemic was going on?
So to that question, first off, I want to say, as far as like being strong and like a strong nurse and being able to emotionally distance myself from the patients and the things that they're going on, because I feel like in the unit that I work, you have to be able to separate yourself from the things you are seeing, because if you carry that with you and take that home every night when you're going home, you will not last working in the type of unit that I work. Unfortunately, in the ICU, the medical ICU, like Kaitlyn said earlier, we hit a lot of patients with chronic medical conditions that cannot be fixed. So we do a lot of end-of-life care. And I feel like with COVID, it was what we usually see exacerbated times 10. And I just feel like myself and a lot of the others that I work with, we use coping mechanisms. We use each other. We talk to each other about different things. We find ways to keep each other entertained, even though we are going through something like this pandemic, which is just awful to see all these people who are losing their lives and families just are being broken apart. And I have different coping mechanisms, things I do to take my mind. When I leave work, I leave work. Everything that happened there that day, some things linger, but I try and separate myself and go home and do things and not think about what's happened at work. And just having a good support system has really helped us. But definitely to deal with COVID, you have to be able to distance yourself from the things you're seeing, because it can consume your life.
Kaitlyn?
Allison, it's a really challenging question. I think even without COVID, death and dying are always going to be a part of nursing. It's not what we want. We don't look forward to it, but it is a part of the job. I think that, like Anjelica said, you have to create a barrier and separate, what happens at work and what happens at home. And you have to have a good support system, whether it's your coworkers or your family, people that you can, talk out things with. And it's okay to be emotional about it. Anjelica would agree with this. We saw some really scary things in the hospital with COVID, things we've never seen before. And we did have to see people die. And it's sad, and it's okay to be sad, and it's okay to be emotional about it. I do think in a bizarre way, you can take some pride in being a nurse, knowing that you helped someone die in the best way possible. There is a little bit of peace that you get knowing, we had a couple of patients who weren't doing well, and, we did everything we could to communicate with their families, get the families to come in and, say goodbye whenever possible, or help them, make that FaceTime phone call so that they could say goodbye. And, just knowing that you did everything you could for the patient, and that they, even if it's just holding their hand as they pass, that you've done everything you can for them, and that you helped them pass with some dignity. I think it definitely helps bring some peace to a really challenging situation.
Allison, anything else in this? Any other questions?
I also wondered how COVID-19 changed the way you worked every day, and how it made you improve and be stronger in your job field for the future when the pandemic is not here.
I do have to say, COVID pushed me into a leadership position that I'm not sure I was ready for, but I had to take on. Like Anjelica, I'm often in charge, and I have this role called the core charge nurse, where I'm in charge of the unit. And as we transitioned to a COVID unit, I had to do a lot of new things that I had never done before. I had to integrate nurses from my floor with nurses from other units, and they all had to work together for the first time. We had to facilitate new staffing models, teaching other nurses to don and doff. To this day, actually, we still get nurses to our unit who have not had, it's their first time taking care of a COVID patient. So, teaching people how to be safe with them. If anything, I think COVID has pushed me has brought out new leadership skills in myself. I think that's definitely how I've come stronger. And, we tell ourselves we can do anything for 12 hours. So I think the challenges of dealing with these new patient population has pushed us to show us what we're capable of doing.
Anjelica, anything else you'd like to add to that?
Yes, I would say COVID really fine-tuned some of my nursing skills for sure. We were doing interventions and things. We do them in the ICU, but to a much greater capacity. The care I give for one very, very sick patient, I was giving to all of them, because they were all very, very sick patients. Drips. We had a lot of patients that were cold. It just fine-tuned my nursing skills that I have. But sometimes when you don't do things, you forget. Just like with anything, you forget, or you have to brush those skills off, and you have to be able to utilize them. And this pandemic definitely kept me and my coworkers on our toes, doing things, trying to whatever we could do to try and change patient outcomes. And I want to say a lot of our patients got better, but there were many that didn't. So it definitely keeps you on top of all of your nursing skills, being able to be flexible and use all the different tools that you need to be a great nurse. I did all that while dealing with the stress of COVID. So it was an eye-opener for me.
So I think we're going to move into questions regarding the health system. And Natalie, are you first up?
Okay, so I was wondering, after experiencing this pandemic, do you think the healthcare field is in a better position to handle like a future pandemic?
I would definitely say that the healthcare system that I came from, we are in a much better position. Just to give an example, like earlier I said, in March through May, I felt like we struggled a little bit, but we became accustomed of what needed to be done to take care of the COVID patients. In August, I was seeing patients that were coming in COVID positive that weren't as sick as the ones I took care of in March. And I think if things stay the way they are now and hopefully don't reverse and go back, we should be well accustomed to be able to take care of COVID patients. If things do start to pick back up again, we have the PPE. They deployed different staff to come and help us. And if need be, I felt like the health system I worked for did what needed to be done. So I could definitely see us being more accustomed to taking care of more COVID patients if things were to pick back up again.
Caitlin, anything else? Yeah.
I think every health system is different. I know I would agree with Anjelica. I think we learned a lot. And I would say I was really happy that our leadership sought out continuous feedback from nursing, you know, for things that went well, things that didn't go well. So if we should have to surge again, we would be better prepared and have a better model in place for how to act. I do think if there's one challenge that still is there, I think that there's a lot of different practices from health system to health system. So I think should we have another pandemic again in the future, I think a big challenge would be more on a national level of how we would act as a country than necessarily as an individual health system.
I had a question as well. My question was, do you see the healthcare industry being able to get over the scare factor that COVID-19 has set forth on frontline workers and their families?
There's definitely an element, there's still an element of fear, I think, when it comes to taking care of COVID patients. I remember the first day we got a patient, actually, I was going to take it. And then another nurse was like, no, you have a daughter, don't do it. And we really, because we just didn't know, you know, how it was transmitted, how it interacted. I think the more knowledge we have and the more education we're able to pass as nurses to patients and to our coworkers, I think that lowers the degree of fear. I do have to say there are still nurses who are still learning to take care of COVID patients. So I think it's really important that we continue to incorporate a shared accountability model. I don't think COVID is going to go away. So I do believe it's something that all nurses should learn to do. We have a lot of new nurses orienting to the unit, and it's going to be a part of their orientation process. At some point, they're going to go to the COVID side of the floor and learn how to take care of these patients in terms of safely donning and doffing PPE and the best way to manage their care. And again, I think just good education and good knowledge sharing. I think the hospital tried to be really transparent with like weekly updates from upper management and our infectious disease team, you know, really just trying to keep to the facts. This is what we know. This is what we know about how the virus is transmitted, and this is what we know about the safest ways to utilize PPE. And I think those facts have helped decrease fear in frontline workers. I can say that I've been taking care of patients since March, and knock on wood, I have not contracted the COVID virus, and I've had a lot of close contact with patients. But the PPE, wearing a mask does work, and it helps protect us.
Anjelica?
I would have to agree with everything Kaitlyn spoke about. Donning and doffing PPE has really, and being able to do that very precisely, being able to do it the correct way will keep you safe from contracting COVID. But I also think there will always be a little level of fear that's not going to go away because you're dealing with something that's highly highly contagious. And you don't want to take that home to your family, your friends, anyone you encounter. So I don't think the fear is going anywhere, but it gives me a peace of mind when I go to work. I know I'm downing and doffing correctly. I'm washing my hands. I'm not touching my face. I'm sanitizing behind when I go and sit down and start typing on the keyboard. And just being aware I think is going to be very important. But I really don't think, especially like what Kaitlyn said, new nurses are going to be coming into this field, that fear will be there. But as you become more educated and learn the correct way to do things, I think it will help give health professionals a peace of mind.
I think Natalie has a question.
So my next question is like, how do you approach people that part of the population that will say things about like the virus not being real?
I see a lot of things online of people saying, the virus isn't real, it's fake, and I've never had anyone come to me and approach me saying that, but my feelings towards those comments is that, if you could only walk in my shoes and see what I've seen and see the patients and their faces and taking patients who have passed away downstairs to put them in the freezer and there's no more room. People won't understand until, I kind of feel like a lot of people won't understand until it really touches them or touches their family member. But COVID is very real. I've had patients who've been all different ages, from 18 to 99, COVID positive. And the way the disease process on someone's body is it's different with everyone. So I feel like though a lot of people who say that it may not be real, maybe it just hasn't touched them or one of their family members. But I just feel like a lot of people may not understand, and it also could be a coping mechanism of fear and saying that it's not real, but COVID is very much real. And I've never actually been confronted with that question.
Kaitlyn, any thoughts?
I also have not personally been approached by a patient who said they didn't feel the virus was real, but I do think as nurses, we have an obligation as part of our job to provide good patient education to all of our patients. And I have had some patients who, as we were, like, I had a couple, it was a husband and a wife, they were both being discharged, and one of them was like, we need to hurry this up so we can go to the grocery store before we go home. And I was like, no, you can't go to the grocery store. You both have COVID. You need to stay home. So we actually went out and bought them groceries so that they would not have to go anywhere in public for a few days. I think that has been a big challenge, really helping people understand how to safely quarantine, how to isolate yourself, protect yourself from your family members so that they don't spread it to their family when they're sick. And I think that has brought a lot of challenging conversations with nurses and their patients. We've had to provide good education, but also it's prompted the hospital to really up our social work support services. Definitely the pandemic, I think, has brought to light a lot of health disparities, and we've found that a lot of patients, again, like Anjelica, I've seen it affect everybody, ages 18 up to 100, and with all sorts of different socioeconomic demographics. And some people don't have the resources to safely isolate, which has forced us to come up with new safe methods. I know at one point we even had a hotel that had donated rooms where people could stay and safely isolate and quarantine away from their families if they didn't have a safe place to be at home. So back to the original question, Natalie, sorry. I think I haven't been approached with people saying the virus isn't real, but I have met people that were lacking the education to safely prevent the spread of the virus. And I think that it comes to nursing to help really close those gaps.
Great. I think Dylan, you had the last question, and then we have a few from the audience, and we'll wrap up. And I'll give you the last student question.
My last question actually revolves back around like your personal health. And I know you guys both mentioned like different coping mechanisms that you guys have encountered through all this. But my question is, with mental health being one of the more important things going on that people are focusing on right now, what are your coping mechanisms that you have gone through to get back home like safely and everything?
I would say some of my coping mechanisms would be just at work. Me and my coworkers, I've worked there for 3 years. We really support each other, and anytime we're having conversations or downtime that we did have, we talked about non-COVID related things. We would talk about something different, something funny, something, that's going on with one of their kids, or just trying to take us out of the mental space of being stressed out and dealing with COVID patients, and we have to wear all these different things to go in and take care of our patients. Kind of just getting into a different headspace helped me a lot. Talking with my friends, people who don't work in the healthcare system, and just talking about different things, not work related. I also like to read. I love a good book. I love to walk my dog. Anything I can do to kind of just wind down, engulf myself in a good show or series or something on TV to just try and take me to a different mental space, because dealing with COVID was like extremely, extremely stressful. We were on mandatory overtime. So instead of working 3 days, everyone was working 4 and 5. Just when I did have that downtime, I would talk to my friends or people who are not in healthcare and talk to them about different things, non-COVID related.
Okay.
I agree with Anjelica. You definitely, even if you're not involved with COVID, as a nurse, you're going to need to have a really like a good support system and know what works for you. I'm also in school in a nurse practitioner program, so I guess for me, coping has been keeping busy. But it's definitely a challenge. You want to make sure I have a good family, a really strong support system in my own family that I rely on heavily to help me vent at the end of the day. Same with Anjelica. I've been on my floor for 5 years now, and I'd say my coworkers are also like a version of an extended family. And you learn to joke with them and talk with them about different things to help take your mind off everything. It's also really important to recognize if you're not doing well. Penn is a great healthcare system that has a lot of support for its employees. They launched a website to help that was free to access for any employee that thought they might be having trouble, coping with everything. And it's important to recognize in yourself if you're not doing well and seek out help if you think you're feeling overwhelmed or too stressed out with everything. There's a lot of support resources out there for nurses. And like Anjelica said, you just have to find a way to make time for yourself and do things that you love, whether it's exercising or spending time with your family.
Great. So one question from the audience actually came up when we had hosted the Chief Medical Officer of NYU, Fritz Francois, who noted exactly what you guys noted, is the acuity of the patients that are coming into the hospital is changing. He had noted that over 50% of the emergency room admissions went right to the intensive care unit back in New York City when it was at its surge, maybe even above 50%. But this question, I guess we'll start with Anjelica, because it says, why do you think patients are not as sick today, given that the number of cases in Michigan has not decreased?
That's a really good question. Why do I think they're not as sick? I just feel like I don't know the actual the way that COVID was affecting our patients. It was affecting each of them a little bit differently. some patients would come in and be in severe respiratory distress. Most of them were, but it would be levels to that respiratory distress. A lot of them did need ventilators, but not all of them. I would have some patients on different devices, air vols, different types of oxygenation, supplemental oxygenation. But I have noticed that patients just are not as sick. And that's a wonderful question, but I really I'm not sure why. Because the cases we still have quite a bit of cases, but, and like I said, even on my unit, the last time I was there, we didn't have a high volume of patients. We had just a few. And I don't know I feel like the patients must not be as sick because they're not coming to our unit. They're going, if they're COVID positive, they may be going to the step down or the respiratory unit. I really don't know. That's a good question though.
Well,
I'm not sure.
Well, that's probably the right answer. You know, what's also amazing about the science of COVID, or just the science of medicine, is it's amazing how much we don't know, despite incredibly sophisticated research. One hypothesis that Fritz brought up that I've heard is maybe, you know, viruses change as they evolve and the infection evolves, and the virus has evolved, not as much as flu, but I don't think really people know. And I don't know, Kaitlyn, if you've observed the same thing, have people speculated about this at Penn?
I've heard different things. I can't speak definitively about anything either, unfortunately. I can anecdotally, I agree with Anjelica. The patients we're getting are much less sick, and actually a lot of the patients that we see now, we call it like COVID plus. They're actually in the hospital for something else, but happen to have COVID. Like we had someone who was on peritoneal dialysis and they had a peritonitis infection in their abdomen and happened to have COVID. So we had to take care of them, but really their problem, they weren't even having respiratory distress or any COVID symptoms. I think it's a combination of things. I know we've gotten more flexible, more creative, like Anjelica said, with how we handle patients who are having trouble breathing. I think in the beginning, we were so quick to intubate everyone. On our unit, we were at one shift, I think we intubated 4 or 5 people from our floor and sent them to the ICU within a 12-hour span. And now, you know, we've allowed nursing on the regular med-surg unit to use higher levels of high flow oxygen, which buys us more time before having to go right to intubation. So I think it is a twofold. I think we have better ways to manage the care of the patients, but also for some reason that I can't speak intelligently to, they do not seem to be as acutely ill as they did in the beginning.
Well, let's wrap up, and I'll give each of you some final comments, but in particular to something that I read about the other day, and that is admissions to nursing schools is skyrocketing now. It's really going up, and maybe we'll start with Kaitlyn. Can you talk to our students at Albion and those that are listening about what it means to be a nurse nowadays, and why it's rewarding, especially through the experience you had, which may explain why it's becoming such an attractive profession, going to be much harder to get into. I'll pass it over to Kaitlyn.
I'm thrilled to hear that. I think it's incredible. The nursing is actually a second career for me. I used to be a teacher, and I love every second of this job. I think nursing is an incredible mix of leadership, critical thinking, but also caring. At the forefront, nurses still provide care to people. We see people at their sickest, their weakest, their worst moments. And I feel great at the end of the day when I know I've done at least one good thing for one person. It is the best feeling in the world. And it will counteract any bad day you ever have. I do think COVID has presented a really interesting, unique national global challenge. It's changed the way we provide care to patients, and it's provided a lot of opportunities for growth. I do think nursing has been the hub of the reason we have had positive outcomes and the reason we've been able to have so many people come out alive. And I feel proud to be a part of it at the end of the day. And I hope other people will see the same as well.
Anjelica, any final comments?
I just want to say I think that's awesome. A lot of people are trying to get into the field of nursing, and it is needed. We need compassionate, strong people who want to help others to become nurses. And I think that once they get into the field, they will love it. I love what I do. I wouldn't change it. I wouldn't be anything different, even though I'm going to be stepping away from the bedside and I'm in school to be a CRNA. I love managing patients, especially critical care, which is why I chose to go this pathway. And I think that once they get into this field, they will find that there's not very many other things you can do that is as rewarding. So I'm grateful to have experienced COVID because it taught me so many different things. And I'm just hoping as a country and as the rest of the world, we can just overcome this and get better.
Well, thank you. And I want to thank the students for participating tonight and the speakers. I mean, Kaitlyn and Anjelica, thank you for everything you've done, everything you're doing. And all I can say is that you made your profession proud by being here and speaking about your experience like the way you have. So best to everyone. And I guess that ends tonight's webinar. And everyone have a great rest of the evening. Thank you very much. Take care.
Thank you so much. Thank you for having me.